We are presenting this recent pattern question discussion, and if you are aware of the recent trend of the examination, you will most probably figure it out which examination this question have came in. The picture shown below is a classical finding seen in early congenital syphilis, late congenital syphilis, secondary syphilis, or tertiary syphilis. This is the picture of Hutchinson teeth. This is Hutchinson teeth, and this is actually seen in cases of late congenital syphilis among the given options. Now we are keeping the discussion, we are not elaborating the findings in all the stages. We are going to do that. We need a lot of time, and right now time is very premium to each and every person who is going to see it. So we are going to keep it a very short one. Interestingly, this particular question as if arises from our book. It have been given in our book itself. Jumping to the next question. 18-year-old male presented with a pruritus, clinical picture and vector shown below. What is your diagnosis? This is pretty classical presentation where you find these papules, which are pruritic papules, and also this is the picture of this vector is female sarcopter scabiei, and it is due to the scabies disease. So that this is the answer of this particular question. Interestingly, this actually given in our book also. Elaborate findings have been given about scabies in our book. Now jumping to the third question. In superficial partial thickness burn, blister formation is due to involvement of which of the layer? Here, the superficial partial thickness burn, which is going to rise to the blister, is actually due to the damage of papillary dermis. This is going to give rise to the blister formation. Reticular dermis is damaged in deep thickness burn, and this papillary dermis burn, it is going to be very painful condition. It is very painful condition. We are also going to discuss, we have already discussed the burn AVD video. We have already uploaded that in YouTube. If you have interest, you can see that. We actually given a detailed classification of vesicular disorder in our book, and also detailed description about burn have been given, which have been uploaded in YouTube just around 3 weeks back. Now this particular question, a female patient presented with fever and joint pain, you have prescribed NSAID. Patient presented with hyperpigmentation over nose and lips after 5 days. Diagnosis is. So seeing the options and going through the trunk of this particular question, there are pretty a few findings which are pointing towards the diagnosis. One is female. There is a ratio of 1:11. It is a very important point that can come as future question, like NV pattern question will be like this. Now there is also mentioning of NSAID. There is involvement of nose and lips. The classical organ which is going to be involved is glands. And there is mentioning of 5 days out here. It is generally within the 14 days. These are the classical important points which helps us to get into the diagnosis of FDE, fixed drug eruption. Again, there are many points can be talked about fixed drug eruption which can come up in the future examination, and which is only going to be uploaded in audio visual discussion because it will take much time. And there are lot many questions came this time from dermatology and related topic from dermatology. Now, maximum number of desmosomes is seen in which layer? So see, we have to have pretty clear understanding of skin anatomy, the layer of epidermis, and which layer have what, and what happens in damages in different layers. We have to have pretty good understanding. And actually, if we go through the vesicobular disorder, we have to have pretty clear understanding of the skin anatomy, particularly epidermis layers, to understand also dermis, the dermoepidermal junction, to understand whether the vesicobular disorder is intraepidermal or subepidermal. And here in our book we already have given pretty important salient point from each and every layer of the skin. This desmosome actually is mostly seen in stratum spinosum. This is stratum spinosum, and C is so the answer. This is the answer. Jumping to the next question, patient presented with vesicular lesion in face and hand. Clinical picture is given below. What is your most probable diagnosis? So out of the four options, all are pointing towards the viral disorder. So which actually leading to this particular presentation? This is a very classical presentation. This is seen in hand, foot, mouth disease, HFM, hand, foot, mouth disease. And we have to remember this is seen in Coxsackie disease and in Coxsackie A. There are two types of Coxsackie, Coxsackie A, Coxsackie B. It is seen in Coxsackie A. Now this is another very interesting question targeting towards the skin anatomy. We have to have pretty clear understanding because they love skin anatomy right nowadays. And which of the following is shown in histology slides? If you see this slide, there is massive disruption of the glands, and we have to remember one mnemonic. This is very interesting. Ham. You just remember this like this, ham. This is the particular order where how the anatomy is going to be preserved. Mostly it is going to be preserved in merocrine. It is mostly is going to be disrupted in holocrine. Holocrine is seen in skin in sebaceous gland. In skin it is sebaceous gland, and in eye it is going to be meibomian gland. These are very important points. May seems very innocuous, but that can be the future questions also. And here the answer is holocrine gland. Again, we are just touching the important points and the question and answer. We're not getting into the detailed discussion. Detailed discussion will be taken in care of in the audiovisual discussion itself. Now, patient presented with dysuria and urethral discharge, you suspect both gonococcal and non-gonococcal urethritis. Drug of choice in such a patient: azithromycin, erythromycin, cefixime, and ciprofloxacin. We are going by the CDC guideline, and right now CDC says it should be 1 gram azithromycin, 1 dose OD. This is the dose that have been advocated by CDC. Now, other drugs that are given, this is erythromycin, cefixime, these are given, but this is the most preferred option. It is little bit better than doxycycline. doxycycline. Earlier fluoroquinolone are given, but right nowadays due to the drug resistance they don't advocate to give fluoroquinolone in cases of gonococcal and non-gonococcal urethritis. And last question that we can go for, we are just mentioning these questions because they are mentioning one part of which are having disease, which are having dermatological manifestation, and patient develop rash, which is a dermatological manifestation, and you provisionally diagnose it to be scrub typhus. So which drug you would like to prescribe? Here also CDC prescribes to give doxycycline. This is the drug of choice in scrub typhus. If you like this particular presentation, again follow us in the Facebook, Twitter and YouTube. And if you have any questions regarding this particular discussion, you just leave your message in the Facebook message boxes, and not in the any profile. Just leave it in the Facebook message boxes. We are going to respond to you within 72 hours. Thank you very much.